On today's episode of Answer This, we're going to be talking about gaps in equity for women's healthcare in America. It's the third in our 3-episode series of Answer This, sponsored by Maternal, that will be taking a close look at issues affecting women's health. Welcome to Answer This. I'm Zincle Asamoah. Inequities in health are evident across gender lines in the United States, especially when it comes to women and mothers of color or underserved communities. Today, I'm joined by Dr. Jaime Slaughter-Acey. She's an assistant professor of epidemiology and community health at the University of Minnesota School of Public Health. Her research focuses on how different factors will impact women's health throughout their lives. Thank you for being here.
Thank you for having me.
Of course. And I want to start simply. Where are the biggest gaps that you see when it comes to treating women in marginalized populations?
Right. I think one of the biggest gaps that we are seeing in terms of healthcare disparities is in the area of Black maternal health.
Yes, and I know that the statistics for Black maternal health are staggering, right? We know that Black women are about 3 to 4 times more likely to die in childbirth than their white counterparts. I also know that CMV, or cytomegalovirus, disproportionately impacts Black infants. How do we make sure that we close what's a really wide gap for Black mothers and their children when it comes to health care?
Well, I think we have to first really think about the healthcare system as a system, and also noting that this system was not, the system's not broken. It was designed to work the way that it does, and that system was not designed to support the health of marginalized groups. And so, in recognizing that the system isn't broken and um, you know, knowing that this is a system, we have to, our solution has to be multi pronged. Um, we have to think about medical education. Um, and we also have to think about revisiting hospital administrative policies that place burden on Black women and other women of color. We have to think about increasing the representation of providers, administrators, and staff that look like the women that they are serving. But we also have to think about um, issues such as racism, uh, since it is a fundamental factor that affects healthcare, not just within the healthcare system, but we also have to think about how racism affects people in the first place.
And what you're saying does remind me of a 2005 study that I know was done by the National Academy of Medicine that found that implicit bias could cause worsening care for Black patients. So, how do we combat this kind of discrimination in the field?
Right. Well, I think one of the very first things that we can start with is increasing the number of medical students, residents, nurses in training who come from Black and Brown communities. The second place is providing medical education training that focuses on implicit bias, as well as how structural racism impacts decisions within the healthcare system for our medical providers. And that includes physicians, nurses, physician assistants, as well as, and maybe most importantly, the administrators who oversee these healthcare systems.
And I know that earlier you even said that, the system is not broken, but in fact, in many ways, it was built to operate in this way. I know that for years, women were left out of studies and different trials for medicines and treatments, and that's especially true for women of color. Given that, how does the absence in this research compound these inequities that you've been describing?
I guess really the first place that I would think about is how do we communicate with women who are seeking care is a big way that the research impacts what we do within the healthcare setting.
Right, making sure that we're focusing on the people. And I know that we've spent a lot of time on the issues and the problems when it comes to healthcare in this space, but where do you see the areas we can improve most immediately?
I think we can first tackle is really looking at administrative policies within the that are adopted by the hospital that disproportionately place the burden on women of color, trying to create a more congruent system of care that's not as fragmented. When we look at Black expectant women, and we're talking about the care that they receive before, during, and after their pregnancy. Um, it is very fragmented, and if we can create a more, more continuous system of care that allows providers who care for Black women before they're pregnant, during their pregnancy, and after pregnancy, then we'll be able to take care of our Black expectant women much better.
And on that, I wonder, how do you advise at risk populations like Black women and other groups to advocate for themselves when seeking medical care, given the environment that you've just outlined?
So I think one of the most important things that you can do is ask questions. Um, I think you should also try to em- empower someone within your social support network to be your health advocate, especially if you're going to be in situations within the healthcare setting in which you will not always be able to be that advocate for yourself.
Well, Dr. Jaime Slaughter-Acey, thank you so much for being here.
Thank you for having me.
Of course, and thanks to everyone for watching. This has been Answer This. I'm Zincle Asamoah.